Well, I've taken a really active interest in what the healthcare professionals are doing because ultimately the results are either going to be positive or negative, and I want to assist that. I want to make sure it's a positive outcome because I'm selfish. It's about me. I want it to actually be good. So when I've been in podiatry, asking questions. When I've been with the diabetic doctors, asking questions. Understanding what the impacts are for this or this or this. And the same with bandaging. I've been watching how they actually bandage things, and I can put a bandage on now. I know how to put it on, I know how to put the components on, I know how to use the tweezers. I take my own photographs, I take my own recordings, I keep a diary. And that's a very important thing as well, because often when you're seeing so many people, you get a bit muddled about what did I tell them? What did I tell those people? Is it consistent? Is the story consistent? Because often when there's a transition from one professional to the other, they may or may not have the story right. So it's been that recognition that I'm responsible for some of this. It's not all the healthcare professionals. It's not my wife. It's not my family. It's got to be me because it's my body.
When the inflammation or the ulcer is really, so to speak, flourishing, there's a lot of scuff. This is sort of bits of skin that have now done their duty and have now broken off, but they're lying around. That has to be removed and removed carefully. The area around there is very sensitive to touch, so you do need somebody who's got a sort of who's done it before and is aware of how it should be handled.
I'm at the point now where I have minimal care. They check it, see where it's going, look at the size of it, make sure it's shrinking and that it's clean. I've also wanted them to visually see it. I find, over telephones, things like that are not the care I'm looking for myself, but I'd be caring it for myself, by myself, every 2 to 3 days I would change the dressing, sometimes earlier, depending on whether I felt like I needed to look at it or it didn't feel right or it was getting infected or and using different substances.
Now I'm back in these boots. This is the third week back in the boots. It's like being on training wheels. Your feet are still getting used to actually having boots on. And I might add that the only set of boots I've got at the moment are virtually like army boots. So they're very, very heavy. They're very noticeable. They're not normal boots. My aim is to get back to some normality. And a good example of that, and a good example of where the caring has changed, there was a little prop made for me a few weeks ago from a new orthotic guy who's come in from somewhere else, and he made a little prop which lifts the toe up. It's been brilliant. It's made out of plastic, sort of thing you could do on a 3D printer, but it's actually been quite effective because it's lifting the toe up. So it seems to me it doesn't need to be a great expense to actually change the architecture of the foot to actually have a better outcome. That's where I'm hopeful that, the more you question, the more you ask, sure, I might be a pain to them sometimes, the better people start to think out of the box and say, oh, okay, no, we won't go to step 5, take all the toes off. Yes, there is a reasonable chance that we can do something to actually retain the structure of the foot and actually retain the mental balance of the person that's actually attached to the foot.
Something which did stand me in good stead, as they say, was that all the time I was working at the university, I was walking to and from the bus stop every day. I think that did help a bit because it's keeping those blood vessels or keeping the blood moving about. And that's another thing that you want to do.
With health in anyone's world, and it depends on the person that it is, but I think the overall function of your body, being happy, trying to do things that don't stress you out, I think that was one key thing is stress. I realised I've had to change parts of my life there, but eating healthy and keeping a general balance, sleep and everything, getting a pattern happening where your body can actually heal itself is one of the most important things, a key thing for anyone, I think.